Okay, my name is Lawrence McGlynn, and you're listening to the award-winning Philadelphia Hall Monitor here on WPPM 106.5 in Philadelphia, on Comcast Channel 66, and streaming live at phillycam.org. You can find us on Twitter at Hall Monitor WPPM, on our website www.hallmonitor.org, or on Facebook at PHMWPPM. Tonight on the program, Councilmember Cindy Bass will outline her spring priorities. Lance Haver will break down President Trump's so-called health care plan. And Denise Clay Murray and I will discuss the press conference Mayor Cheryl Parker held yesterday and preview City Council's first session tomorrow. So what we're going to do, let me bring on Denise Clay Murray here. Denise, how are you tonight?
I'm good. How are you?
Big day tomorrow.
Yes.
First day of the the spring City Council session. I'm very excited. I've been waiting for this since the last one ended, so it's been a while. So it's going to be fun tomorrow.
Well, hopefully, we'll learn some things tomorrow.
Yeah.
But we can talk about that a little later.
Yep. We'll talk about that in the second half of the show,
Mm-hmm.
or the third of the show is what it will be. But first, here is our interview with Councilmember Cindy Bass. All right, Councilmember Cindy Bass, thank you so much for joining us.
Thank you so much for having me. It's my pleasure to be here with you.
So can you tell us a little bit about some of your priorities for the spring council session?
Well, certainly. Some of the work that we're going to continue to do is following up on or building on the work that we've done over the past, particularly on nuisance businesses, because quality of life is critically important in the 8th Council District. So as you may recall, we've done a lot of work on this issue for many moons now, and really trying to get some of our businesses to operate in a way that's going to complement the community and not be a detriment. One of the things that we've been working on is calls for suspension of the licenses for businesses that are not in compliance with state regulations and whose physical layout differs from what they originally approved in the floor plan. Because one of the things that we realize is that people will set up to be a restaurant and get a restaurant license, which is required to be, to be able to sell alcohol in the Commonwealth of Pennsylvania, but then really just kind of scrap that and just go straight into selling alcohol once it's been approved by the city of Philadelphia. So we're going to be reaching out to call for the suspension of licenses for businesses that have not been operating in a way that we would like to see. Also, we know that tobacco sales, and we've done a lot on tobacco sales over the years. We have a bill that we're presenting and moving forward in this legislative session, which is really going to say that, if you get caught selling loosies, that you have to, on your first offense, you have to publicly post a sign saying basically that, you have been, it's been recognized that this is an establishment that's been basically caught selling loosies, or selling to those who are underage, and can no longer either sell tobacco or must sell to those who are 18 and over. So, that's something that we've been bringing forward, that we're going to be bringing forward as well. We've also been working with some of our colleagues. We know that Councilwoman Kathy Gilmore Richardson and Lozada have done curfews on some of our businesses, some businesses throughout the city. We're going to be working on that in a very robust way as well, so that these businesses cannot be open all hours of the night, and also paying particular attention to smoke shops, which have been very much problematic in the way that they've been operating with their hours, and specifically on the curfew legislation. We want to take a look at them. So those are just a few of the items that we've been working on. We also have been working on, you may recall this one from last time out, our puppy mill bill here in the city of Philadelphia, which is really around backyard breeding. This is around sort of like a recreational breeder. I'm going to breed this dog. I'm going to make a few dollars. This has been problematic in the city of Philadelphia. As a board member for ACCT, which is Animal Care and Control Team here in the city, we see all the times where people will take a litter of puppies that they haven't been able to sell and sort of dump them in the park. And so this is problematic as well. And we want to get in front of this issue. And we expect final passage on that piece of legislation early in the legislative session. So those are just a few of the items that we have been working on, and we're going to continue to work on during this legislative session.
Okay. So we're recording this interview before a press conference that's about to happen in your district, but it will air after the press conference. Can you tell us a little bit about that press conference and what's going to be happening in the 8th District?
Certainly. So the press conference is about the request for information. The mayor reached out to us over the weekend and mentioned that she is interested in getting proposals and ideas. So it's a request for information for manufactured housing here at different sites throughout the city of Philadelphia. I know that one of the sites she's preparing to look at is in the Logan section in my district, which is the former, well, what's called the Logan Triangle, which were the sinking homes area. So this is something that she is proposing and interested in. So we're looking forward to going and get additional information. I know that, again, this is going to be aired after the information comes out, but we're very interested in the jobs that will be provided, how that's going to affect the surrounding community. We want to make sure if there is such a proposal that moves forward, that people locally have an opportunity to participate. So, we know that these are going to be jobs that provide a sustaining wage, a living wage. And these are jobs that need to be provided to people who have been holding down our neighborhoods for a very long time and who are really struggling and looking for opportunities. So I want to make sure that if this investment comes through, that we have the opportunity to provide it to people who live in the neighborhood.
Okay. So we are almost in budget season. That's what happens when January comes up. Can you tell us how you approach the budget? How do you look at it? How do you spend the time breaking it down and getting it ready? And what are some of the priorities you're going to be, and how do you decide on your priorities for the budget?
Well, the budget is not a one and done conversation or even one season and done conversation. Our budgetary items generally run from one year to the next because you generally don't get everything that you're looking for, everything that you want to see during one budget season. Actually, I won't say generally, I'll say never. It doesn't happen all at one time. So it's really a continual process of recognizing where there is a need, particularly as a district member. So you have to recognize where there is a need, what needs to happen, where funds need to be allocated, how are we going to change, support, make a difference in some of the things that really need to happen to make our city operate better for all of its citizens. And so this is it's continuing. At the end of the fiscal year, which is June 30th, just because the fiscal year is over and the city's budget is passed, does not, in my mind at least, mean that the process is over. Because again, it is ongoing. And so this is something that we look at. We bring forward our proposals, and we continue to try to figure out, okay, this is something that's needed for this particular neighborhood. Every neighborhood needs something. What that is varies from area to area. And again, as a district member, that's what I'm looking at, is how do I bring resources into the community in the 8th Council District? And of course, looking at the entire city and making sure that things look balanced, things feel very balanced. And so we know that there's going to be additional conversations coming out about, significant changes, from the city, from the school district, from various areas citywide. And so how do we affect that is the question.
Are you concerned that decisions made at the federal and national level will have a negative impact on Philadelphia's 2026 activities and just really the city in general?
Well, absolutely. I think that we all have to be. We have to be concerned about what's happening in the city and the 2026 funding that's going to be tied to it. Because we have, I would just call it instability on a federal level. We don't have, the level of confidence. I don't believe that we're going to be able to rely on funding that has come in the past, that those funds, those sources are still in place. We know that the federal government has been continually shrinking under this presidential administration. And so, making sure that we get the funding that we need and that we can pivot if necessary is crucial. We're certainly hopeful that the Commonwealth will step up if it's necessary. We know that there is a budget surplus on the Commonwealth side, and this is going to be definitely an economic generator that will produce results and investment coming back to the state and federal government. So we just certainly hope that our other government partners recognize the importance of this moment, the importance of the investment, and that this investment is going to pay off at least 2 or 3-fold, I think.
All right, I'd like to bring in Denise Clay Murray here on Philadelphia Hall Monitor.
Thank you, and thank you for joining us this afternoon, Councilmember Bass.
Thank you for having me. I'm sorry I'm not on camera, but like I said, we're moving around a lot. Tomorrow is our first session day back, and so there's a lot happening.
Now, how did you spend your time off of session? Because that's kind of a question that people have about, their council people. They don't see them on every Thursday on city council, in city council. What do you do during that time, and how does it prepare you for the next session?
Well, this is I'm laughing just a little bit because there's this assumption, I think, that when we're off from legislative session, that somehow we're on break, and nothing could be further from the truth. We work days, nights, weekends, summer, spring, fall, Christmas break, summer break. There is no shortage. There is no shortage of things to do. It is an opportunity for members of council to get caught up. So it's a chance to catch up on all of the emails and all of the texts and all of the calls that you really just may not have had a chance to get through during a regular legislative session time period. And so you're spending time getting caught up, and as well, you're also working on preparing for the next legislative session. And so again, there's no shortage of things to do, places to go, and people to see. We continue to work, and I think it's really a misnomer. I think maybe at one time that was kind of what happened. Council went out of session, and members went to the shore. That just doesn't happen anymore. I don't believe. I see all of my colleagues. We see each other. We see each other out and about. And I have to say, if you don't see your member of council, I don't know who your member of council is, because I see them. I see all of us out working, engaged, communicating. I get emails, texts. People are engaged. So we're definitely making the rounds and talking to the people on a regular basis.
Now, as you know, the school district is finalizing its facilities plan, which means there may be some more schools that are closed. You have been among the folks talking to the district about the Ada Lewis School and that building being closed in light of what happened with Kata Scott. Are you concerned about the school districts, the possibility of closing more schools? Are you keeping an eye on that?
Well, we have had conversations with the district, which are not for public conversation just yet. We have been asked to hold those conversations until Friday so that they can release their information. And so respectfully, I have committed to do that. But I will say this, whatever school is closed, I am greatly concerned. We know that that is, in the past, it has meant lower academic achievement. It's meant that young people have sort of dismiss themselves from the entire process of being educated by the Philadelphia School District. We know that some of those students, even from COVID, when we went online, we know that some students sort of left the district and never came back, and we don't know what happened to those young people. So any changes which disrupt uh, the educational process for our students is of concern, is of great concern. So until Friday, I do not want to, be disrespectful of the district and give them the opportunity to present their case to the public. But obviously, any closures or any changes, because it's not always a closure. There could be other changes that happen that can be disruptive to the educational process. So, we're going to give them their opportunity to make that case publicly.
Now, as you know, we're in 2026, and basically because it's America's 250th birthday, Philadelphia is kind of going to be at the center of the universe for some of that. One of the things that everyone kept saying when announcements were made about how the 250th anniversary was going to be celebrated in Philadelphia is that it would be something for there would be something in every neighborhood. You would
Yes.
be able to have something in every neighborhood. Has
Yes.
what's going to happen for the 8th district? Has that planning process started? What are some of the things people might be able to look forward to if there's things that are set up?
Well, I can tell you that we have a very robust planning committee that's working in Germantown and also in other parts of the district. So we've been working hard to make sure that throughout the 8th Council District, whether you're in Chestnut Hill, Mount Airy, Germantown, Nicetown, Tioga, Alany, Logan, North Philly, any of the areas that we represent, that there is going to be activity. And so how that's all unfolding is still being processed. I can tell you that we have had conversations with Philadelphia 250. Michael Newmis just gave us a briefing today, as a matter of fact. At the last meeting I was at today, the mayor's intergovernmental conversation, we got a very full briefing about what's going to be happening citywide and also some information about what's going to be happening district in each specific council district. But I can tell you that one very robust example we have is the Germantown 250 group, which we've provided funding for through our office and heavily supported, and they're working with other neighborhoods. We've also provided funding, to Sarah Lomax Reese and an organization through WURD and a program that they have on ensuring that the African American experience in America is properly chronicled and put forward. So we provided funding for that. My office has, and a number of other issues as well. So we look forward to seeing the results of those investments, that those investments are going to bear fruit that's going to really just resonate, not just for people who are coming into Philadelphia for this activity, but much further than that.
Now, the city has invested a lot of money into America 250.
Yes.
And I'm hearing from friends of mine who are soccer fans in particular that folks may not be coming to America 250 events because they're kind of afraid of coming to America. So, I guess what can Philadelphia as a city do to let these potential visitors know that even though the climate overall in the country may seem unfriendly to you, we're not?
I think that there is going to be some folks who are going to be boycotting activities and they're going to speak with their dollars and not come. I also think that there are other people who are not going to be taking that sort of political stance and who will be coming to Philadelphia specifically for these activities. I've read recently that there were some number of thousands of tickets, 15, 16,000 tickets that have been declined. People have purchased them and then, turned them back in and sort of wanted a refund. But I also read that there are a number of folks who then had an opportunity to pick up tickets that otherwise they might not have had. So I think that there's a few different things going here. There are some people who definitely feel some kind of way about the posture of political events in this presidential administration and the way that they're conducting themselves. And there is going to be some fallout from that. And but I also know that there are other people who will be stepping into that as an opportunity. They will see it as an opportunity and still be coming to Philadelphia and not being engaged on a political level.
Okay, well, thank you so much for your time, council member. I'm going to give you back to Lawrence McGlynn, my co-host, and you're listening to Philadelphia Hall Monitor on WPPM 106.5.
All right. Thank you, Denise. And Councilmember Bass, thank you so much for joining us.
Thank you so much for having me. It's been great.
All right. We'd like to thank Councilmember Cindy Bass for joining us on the program. And now we'd like to bring on Lance Haver to tell us a little bit about President Donald Trump's so-called healthcare plan.
So, good evening, and thank you very much. I do look forward, like you two, to seeing what's going to happen in City Council. There's an awful lot of things going on in the world, and I'm sure Council will play a role in at least speechifying, maybe not doing much, but at least talking about it, which isn't in and of itself a bad thing. Speaking of just talking about things, I'm here to report on President Trump talking about healthcare. Now, I want to give a little bit of background here. As many people know, President Trump has been a big foe of the Affordable Care Act, the bill that President Obama and Vice President Biden signed into law and went into effect. President Trump, during his first term, promised to come up with something much better and much less expensive. 4 years went by and nothing. He then ran on the ticket of saying he's got a better healthcare plan. Didn't announce it, didn't explain what was in it, but apparently many of us voted for something that we thought would be coming. 1 year into his second term, he's finally released what he considers his great healthcare plan. And I'd like to go over it. It's going to be somewhat difficult because there are 8 major points, and few of them are clear, and a few of them are on their face, just can't work. But let me start out by explaining why it's so difficult to talk about healthcare plans and healthcare savings in America. We are fractured in how we deliver healthcare in the United States. The majority of us get our health insurance through work. There is a significant number of us who get our health insurance through Medicare or Medicaid. It is a relatively small percentage of us, 10.2%, who actually buy health insurance, whether on the open market or through the Affordable Care Act market. So when we talk about all of the things that President Trump says he's going to do to improve the Affordable Care Act, we ought to keep in mind that he's really only talking about 10.2% of all the health insurance policies that are purchased. And we ought to remember that in the bad old days, before President Obama passed the law, health insurance companies could do the following things. One, they could decide they're not going to cover pre-existing conditions. And pre-existing conditions could be anything the health insurance companies said they were. So it could be something as significant as treatment for cancer, or something as insignificant as someone as being 10 pounds overweight, being considered obese, and therefore not covered for any of the other problems. Second thing is, if you got sick while you had the health insurance, they could decide not to renew your policy. This was perfectly legal. So you buy, you pay, and then as you get older, we tend to use more and more health services, and you start to use the healthcare policy that you purchased for the last 10 or 15 years. Health insurance company decides they're going to cancel you and not renew you. Third thing health insurance companies could do on a routine basis is have what's called a lifetime limit. So anybody who's had the unfortunate experience of being hospitalized in an intensive care unit, an ICU unit, or had a child in a MIC unit knows how expensive it is. And insurance companies were saying anybody who reaches $500,000 in expenses would be dropped. They would no longer have coverage because there was a lifetime limit. Now, unfortunately, it is very easy if you're in a bad health situation to reach that $500,000 or $1 million limit. The Affordable Care Act did away with those things. They also allowed young people to stay on their parents' policies. And they did one other thing that was incredibly important, which is they required insurance companies to spend at least 80% of all the dollars they bring in on healthcare. They can only spend 20% on their own profits and on overhead. Now, there was a provision that said if a health insurance company wanted to raise their rates by more than 15% in 1 year, they had to justify it. Sadly, that part was never really enforced because the justification could be meaningless and insurance companies were free to raise rates. So as a result of all that, here's what we're looking at. If we don't look at Medicare and Medicaid, and we don't look at what people pay for insurance through work because those are negotiated separately, we only look at the policies people can buy over what's called the market. Without the Affordable Care Act, if you buy a policy without the subsidies that come with the Affordable Care Act, the average policy for a family of four is $1,500 a month. If you buy it with the Affordable Care Act and with the subsidy, that same plan would, on average, again, and it's difficult to say on average when we talk about health insurance, but that would be roughly $477. So any Trump plan would have to save $1,023 a month or $12,276 a year to make up for what he wants to do, which is eliminate the ACA subsidies. So let's look at what he's doing. The first thing he says he wants to do is codify what he calls the most favored nation deal for drugs. And that is for any medicine that's sold in any place in the world at whatever price, the American has a right to pay for that medicine at the lowest possible price. Now, how can anyone be against that, right? Many of the companies come from America. Americans give tax breaks for corporations to develop medicine. We pay higher prices. We do all those things. How can you be against forcing drug companies to go ahead and sell the drugs for the lowest possible price? And the difficulty is it doesn't work. This has been in effect. And this year on January 18th, the pharmaceutical industries just raised the prices of 835 drugs by 4%. So this provision that's been in effect, that when President Trump says in his plan he wants to codify it, I mean, he wants to write it into law, he was trying to do it just by negotiations. He said he had that agreement. Many of us have heard him say he's lowered drug prices by over 1,000%, which I'm not even going to go through the math. I'll let somebody else figure out that that's impossible. But it doesn't work. Drug prices continue to go up, and getting the drugs at the lowest possible price that's sold to another nation, unfortunately, hasn't solved the problem. And even if it solved the problem, it would only solve the problem for that 10% of us. The other percentage of us wouldn't be getting the benefit. Now, maybe he'll do it for Medicare and Medicaid. Maybe he can figure out a way to force private insurance companies and employers to negotiate that as well. But it hasn't worked yet, and there's no indication it will work. So that's the first point on his plan. The second is to allow more pharmaceutical drugs to be sold over the counter. Now, this is one of those difficulties. Now, I know many of us think, well, you know, what is the harm? Doesn't that make sense? Why should you have to see a doctor?
Well, yeah, that's my question, Lance, because to me it would seem like there's a safety issue here.
Well, that's right. It's also the exact opposite of what Bobby Kennedy Jr. has been talking about. The reliance on more and more medicine, unfortunately, doesn't solve our problem. Our health is really difficult to resolve. We have many, many chronic illnesses in the United States. That's why there's been a tremendous amount of emphasis on what people eat, what they should eat, what they shouldn't eat, and there is disagreement. But there's almost nobody who says a solution to people's chronic health issues is take more medicine. We know the medicine is dealing only with the symptoms, and it doesn't solve the underlying problems. So what happens when we say to people, well, you don't have to see a doctor anymore? and you can just go to the drugstore, if there are any left, and that's a separate conversation, if there are any left around you, and just get whatever you want. Well, what's going to happen? One, whatever's creating the symptom won't get diagnosed. So maybe it's heartburn, but maybe it's something more serious. Maybe it's a minor skin infection, but maybe it's something more serious. Without going to someone, maybe it shouldn't be a doctor, maybe it should be a physician's assistant, maybe it should be some other form of healthcare worker. But without having somebody who's trained to look at what the symptom means, it's very difficult for someone to go in and just get the painkiller or whatever. And we know what's going to happen because we have this experience. People will go in, they'll go to Google, they'll use Dr. Google, they'll diagnose themselves, and they'll get something to relieve the pain, which will not solve the problem and may make them sicker. So again, it sounds like one of those ideas. It just sounds like such a knee-jerk idea. Well, I know what we'll do. We'll just tell people you don't have to see doctors anymore. You just go in and get whatever you want. And we're going to make sure it's safe because somehow we're not going to know.
Right.
And
Now, isn't this kind of, because when I'm sitting here and I'm looking at this and I'm like, okay, if you make more pharmaceutical drugs available for over-the-counter purchase, you invite a whole new avenue of drug abuse.
yes.
Because it's bad enough now that you can't get certain types of cold medicine over the counter because people are using it to make crystal meth. If you do this, you've basically opened the portal for more drugs.
Right. You're absolutely right. And again, the problem is there aren't enough doctors and physician's assistants. And so rather than solve that problem and make more medical schools and make it less expensive for people to get college education and get medical training, the solution is to do away, to say you don't have to see a doctor. There's no reason for you to see a doctor. We're not going to address the fact that in parts of the city, in parts of rural Pennsylvania, there just aren't enough doctors to go around. We're not going to talk about that. We're simply going to say, you have pain, go into the drugstore and get painkillers, and you don't need a prescription for them anymore. Now, they do use the word safe, and that's, again, questionable what that means. The third point is they're saying they're going to stop sending big insurance companies billions in extra taxpayer-funded subsidy payments, and instead they're going to send them directly to consumers. This is an attack on the Affordable Care Act. And again, I don't know anybody who really likes insurance companies unless you own shares in their company or you work for them. Insurance companies make their money by not paying claims, by investing money and doing things that are really problematic. If you go online any place and you go to any insurance company and you look at what people are complaining about, they're complaining about how long it gets a claim, how long it takes to get a claim paid, denials, and there's a real question about any health insurance company deciding what treatment you should get and what treatment you shouldn't get because they're not doctors and they're bureaucrats and they're deciding that that treatment that your doctor has prescribed for you is not going to be covered and therefore you can't get it. So, lots of reasons to be mad at insurance companies. But will this solve the problem? And the answer is, unfortunately, it will not. It's, again, a knee-jerk reaction. So if we send the money, and again, it has to be a lot of money to make up for the difference. We send it directly to you. How are you going to know whether that insurance company is going to treat you fairly? The answer is you can't. There's Milton Friedman, a Nobel Prize-winning economist who comes out of the Chicago School, who's a big champion for free market solutions. He wrote in his book that he wrote with his wife, he said, for free markets to work, it has to be a free choice. And then he goes on to say, when a robber comes up to you and says your money or your life, you have a choice, but it's not a free choice. And a market cannot work if it's not a free choice, if it's not a reasonable thing to decide, I don't want to buy it. So free markets work great for big screen TVs or even the newest cell phones or many, many things where it becomes reasonable to say, I'm not going to buy it. Or I'm going to shop around and I'm going to find the best price and I'm going to put pressure on the company to bring down the price or bring up the quality. But the idea that shopping for prices when it comes to health insurance is a rational decision, it's ridiculous. Now, again, I'm older, so I've had the unfortunate experience of having loved ones in a situation where you have to call the ambulance. My father passed of a heart attack at home. Now, all I can think when I hear these people talk about it is, while we're frantically calling 911 and hoping they're going to get there in time, that these people think I should have been calling around to other hospitals to see who was running a sale on heart attacks.
Yeah.
Or calling the ambulance company and saying, hey, just want to find out how much you charge to take my father, who looks to be dying, from his house to this hospital, because this hospital is running the special on heart attacks and the hospital closest to us isn't. Now, anyone who believes that's a rational thing to do really needs some help. So this idea that we're going to send the money to people directly and they're going to shop for the best medical care doesn't meet the criteria of a free market solution. So I'm sorry, I think I skipped one. Yeah. So this one I tend to skip over because I can't tell you what it means. They're going to fund a cost sharing reduction program for healthcare plans, which would save taxpayers at least $36 billion and reduce the most common Obamacare plan premiums by over 10%. I actually know this stuff, and I know it very well. I participated in many rate cases around insurance rates. At one point, I actually was licensed to sell insurance. I know these issues. I can't tell you what this means. What I can tell you is a 10% savings wouldn't come close to making up the difference between what it costs on the open market without the Affordable Care subsidies and what it costs with the Affordable Care subsidies. As we talked about earlier, the difference is over $1,000 a month. It's over $12,000 a year. 10% savings is $120. So even if you got it $120 cheaper through whatever this cost sharing reduction program is, you would still need $11,000 savings someplace else. So I tend to skip over this point. Either of you have any idea what these words mean?
No.
No, it's a interesting looking word, salad, but alas, I do not know what it means.
If you
Right,
take them
so-
one at a time, I get it. But if you put them together, it doesn't mean anything.
There's nothing in here that you can be against, right? Who's
Yeah.
against cost sharing? Who's against reductions in prices? Now, Dr. Oz at the press conference where it was announced was asked directly, okay, what does this mean? And he declined to answer. He said, well, the White House is going to fill in the specifics. This is just a framework. So we don't know what this is. Hopefully it will mean something good, but based on everything else, I fear not. The fifth point is something that, again, sounds great, and this is a complicated issue, and I don't want to suggest it's not. There's a business called Pharmacy Benefit Managers. They go by the initials PBMs. And this is a company that is a middleman, buys the medicine from the pharmaceutical companies and sells them to the drugstores. This has been a company that has been abusing the system because the insurance companies own them. And while they negotiate prices, they don't do it with transparency. So they sell the drug and then they get a kickback from the pharmaceutical company. So they sell the drugs to themselves, charge the price to the consumer, and then the pharmaceutical company gives the benefit manager a premium, a kickback, something to say, well, because you sold X number of these pills, you're going to get a rebate. And that rebate doesn't flow to the end user, doesn't flow to the consumer, doesn't flow to the patient. That rebate flows to the bottom line of the pharmacy benefit manager. So this sounds, again, like a great idea. Here's the reality. There was a bill that had been introduced, that had passed, and that President Trump's person in charge of getting rid of waste and mismanagement in government, Elon Musk, decided, ready? And I'm going to try and say it without laughing. He said, there are too many pages in this bill. Right? It's a complicated issue, and it's really difficult to figure it out. So Mr. Musk decided, in the name of efficiency, to take out many of the pages in the bill, and as a result, the bill didn't pass. Now, there is a bill in the Senate now that hopefully will pass that will start treating the pharmacy benefit managers like public utilities as opposed to for-profit companies. We'll have to see if it passes. But the idea that, on the one hand, the Trump administration says they're going to have the lowest price available throughout the world, and the other hand, they're going to do something to end the kickbacks from pharmacy benefit managers, doesn't make sense. If you already have the lowest available price, then there's no reason for this industry to exist. The pharmacy benefit managers will cease to have a reason to exist because the drugs are already at the lowest possible price. So there's no reason for this to work. If you're not going to have the lowest possible price, and there are going to be pharmacy benefit managers, ending the kickbacks will only find another way for them to control the market. And the Senate bill is a much better version, and that is treating them like public utilities, where they are the pipes or the wires that take the pharmaceutical money from one place and bring it to the consumer, just like the public utility takes the power from the power plant and brings it to your household. That's what these people do, and they end up being regulated, and they'll be allowed to make a profit, but the profit will be limited. So we'll have to see what happens here. Again, this is a complicated issue. We do need to address how the pharmacy benefit managers are putting small pharmacies out of business, are making it harder and harder for people to get their medicine, and more likely for people to get it from Amazon, which again becomes that health challenge, because there's really nobody to talk to about the interaction between what over-the-counter medicine you're taking and what medicine you're getting prescribed. Yes, if you get from Amazon, they may know what other medicine you're getting prescribed, and they may be able to check the interaction. But you're not talking to a person. They don't know whether you're taking some vitamins, some supplements, maybe fish oil, maybe vitamin D, whatever. There's no person there to have that discussion with, and that again makes it riskier than what it is now. The seventh point is that it creates a plain English insurance standards. And I'm going to put these next couple points together, 7 and 8. And they want to require insurance companies to publish the percentage of revenues paid out in claims versus overhead and profits. Now, on point 7, we already discussed the Affordable Care Act required the companies to spend at least 80% on healthcare. All this will do is take away that right and take away that definition and take away that regulation and say, well, all the companies have to do is tell you how much. And if we go back and you say, well, they're going to have to put in plain English the standards that they use. Again, that suggests that these are free market solutions, that all you have to do when it comes to healthcare is put the price up like you would on a television set, and people can look at the price and compare it. But it's not the same, because we don't know what illness we may get in the future. And we don't know which doctors we may have to see in the future. So even if there's plain English and it tells you, we're going to treat X, Y, and Z, and you say, well, that sounds pretty good to me because I don't think I'm going to get A, B, or C. And then you get A, B, or C. Well, now you've already made a decision without knowing what the future holds. And plain English, well, it's impossible to be against that. It's impossible to be against people having the ability to understand what they're purchasing. But that's not enough. It's not enough to say, well, we want you to understand that you've just limited your rights and you've just agreed to a copay that you can't afford. Number one bankruptcy in America continues to be healthcare payments. People get sick. The copays are so high. The other expenses are so high that people go bankrupt. Those are the problems. The plain English, that we need to have that. But that, of the top 10 problems when health insurance and health in our system, healthcare, plain English is way down on the list. Affordable, universal, something that everyone has a right to, something that everybody can access. Those are the important points, not that it's plain English. That would be point 8 or 9. We should have it, but let's focus on affordability and let's focus on full access. And the final point is they want to provide patients with clear, accurate, and actionable healthcare pricing information. And again, this goes back to the point I made in the beginning. I can't imagine a loved one needing healthcare and you sitting there and saying, well, let me shop around and see if I can get it at a lower rate. All of us who have loved ones who have had health problems, or even health problems ourselves, know that that is a ridiculous idea. If you have a health emergency, the ambulance isn't going to take you to the hospital that has the lowest price for that service. Even if it's a relatively simple illness like a broken bone. The ambulance that picks you up doesn't say, I'll drive around until you find the hospital that has the lowest cost for setting a leg. Clear, accurate, and actionable health information, yes, we need that. Nobody's against it. But to say that that's the solution to the healthcare crisis in America is ridiculous. And that's why it's so hard to look at what the Trump administration is doing and not recognize that this is really the work of the guys who go to the home shows and the carnivals and have something that they say will clean everything, or a moisture magnet, or a defogger for your glasses. The salesman sounds great. They sound great. They say, look, the companies aren't telling you this. Here's what you need to know. There's a new innovative solution that will solve all your problems. And all you have to do is give me $19.95, and I'll also throw this in with it. These are the tricks of con artists. Say a few things that sound great. Say some things that you can't be against. But it does nothing to really solve the problem. And the problem is we can't afford health insurance. And while the Affordable Care Act was a step forward, and it certainly was, and anyone who doesn't acknowledge that is really just misleading people, it's not enough. And the people who defend the Affordable Care Act as it being enough are also misleading people. It's too expensive. And now with the end of the subsidies, for many people, it will become unaffordable. And the people who are going to give it up are going to be the younger people. And what that means is those are people who have the less usage of the medical systems. So the prices for health insurance for everyone else is going to go up as well. So I wish I had better news. I hope the benefit manager bill gets passed by the Senate. If it does, I'll report on that. And that will actually be really good news. And hopefully Elon Musk is no longer involved and he won't complain about how many pages the bill has.
Yeah. Well, Lance, thank you so much for that. And we're going to, this is one of the many big stories of this year, I think, is what's going to happen with healthcare. So thank you so much for doing that, Lance.
You're welcome.
I muted myself for some reason. Denise, you're not going to believe what tomorrow is.
Oh, I will. It's the first day of City Council for the winter session or spring session, or I always get mixed up as to what that is, because it's just basically a continuation of the September session after Christmas break.
And I have our first piece of news about tomorrow. The home program bond ordinance is expected to be passed tomorrow without changes. I was told that by a very good source. So the home plan is one step closer to coming to fruition.
Now, I'm surprised that it's being passed without changes and that no one has tried to get changes, because what I'm hearing from folks is that Mayor Parker was all set to go out on another one of those, going to churches and, talking to people about doing this plan her way towards.
Yeah.
And the fact that council is going to go ahead and pass what they passed out of committee and what was read, in first reading, just before we went to winter break, it is kind of significant, because, that means the $277 million that is supposed to be weighted on the side of helping those most in need is going to stay that way. Now, what's going to be interesting is the next bunch of money that the mayor wants for the home program. What that's going to look like. That's what's going to be that's interesting to me on that level. And also it's going to be interesting to see what, if anything, what the big ask is for this upcoming budget, because first year $100 million for Kensington. Last year $800 million for the home program. That's $900 million right there.
Yeah.
What is this year's big ask? It's going to be interesting to see if that is. I'm hearing it might be connected to the bill or executive order she signed before break that allegedly got rid of homeless people being on the street.
Mm-hmm.
It may be connected to that.
Well, we'll find out, because budget's going to come up real soon. It's going to be here quick.
Mm-hmm.
And probably this time next month, we'll have a clearer idea of what some of those items might be. We won't know for sure until the budget address happens.
Mm-hmm.
But I think, in a few weeks, we'll have a better idea. So before we get back to council, I just want to switch gears a little bit. There was a press conference yesterday that the mayor had in the mayor's reception room. It was one of these star-studded events where almost every politician in the city was there and spoke. And what I want to ask you, Denise, is do you think the payoff of that press conference warranted the buildup? And I have a very clear answer on this for me.
I thought, because it was presented as we're going to do this public-private partnership, and it's going to be the unions, and it's going to be all of these, and PHA, and it's going to be about affordable housing. I thought citywide affordable housing. I thought this is going to be some great development that's going to bring like maybe 30 affordable housing units, like a series of homes or something like that.
Mm-hmm.
And it ended up being the city, PHA, and the unions coming together regarding Brith Shalom. Yeah. And Brith Shalom is a senior citizen apartment complex that basically was falling down around the ears of the people who were living in it. And it forced people to move because of that. And folks came to council and said, hey, you should take this building on. People are being disenfranchised. And, it's in Curtis Jones's district. So he said, yeah, we should do that. The city ended up buying the property. And they found that Brith Shalom had a lot more wrong with it than they originally thought. And earlier today, they found out that there was even a little bit more wrong with it than that.
Yes.
With the discovery of a dead body.
Yeah.
In the home.
Yeah.
So, I'm glad that they're going to do something with Brith Shalom, because that did, the people came to council every week and talked about it. So it obviously performed a very important function and met a vital need. But, it seemed a little anticlimactic, because when you hear public-private partnership, PHA, the unions, you think this is something that's going to benefit the entire city as a massive thing. And that's not what this was.
No. And in the grand scheme of things, we're not talking about a huge amount of money. $50 million, don't get me wrong. It's a lot of money. But for the scale of what we're talking about here citywide, we're talking about a $50 million loan that the unions are making to PHA that will be repaid back in 15 years at 4% interest. All right, well, that didn't really move the needle that much for me, to tell you the truth. And the city is guaranteeing the loan in case something happens. And if PHA loses federal money, which could happen right in the next couple of years, you never know. Could the city be on the hook for that? I don't know. possibly. But to me, it was a little anticlimactic.
Yeah, and the thing is, the one word I am getting really tired of hearing from city in connection with city government is the word loan.
Yeah.
I'm getting really tired of that word. And the reason why I'm starting to get really tired of that word is because the person taking the loan out and the people who have to pay the loan back are two different sets of people. The way that things are going right now, there's probably going to be a mayor of Philadelphia in like 2050 that's going to want to do something big and important for the city, and they're not going to be able to do that because they're still going to be paying on the loans that were made in 24, 25, and 26.
Yeah.
And that's not fair to the long-term health of the city. Now, I understand that the loans that are being taken out are important loans and things that need to be done, and that's great. And I definitely want to see affordable housing. I definitely want to see people, getting drug treatment, and I definitely want to see, the quality of life improve for neighborhoods where the opioid epidemic and even the crack epidemic from the 90s, something we never discuss, where those two things are still beating up neighborhoods. I want those things cleaned up. I really do. But, while I know government can't do a GoFundMe, I also have a problem with government taking out not only loans, but taking out loans that are going to take you 15, 25, 30 years to pay, because that's not fair to the people who come behind you.
Right. Right. And for PHA, I look at it and think, well, all right, you're getting some money up front, but you're paying back more in the long run that you could be using for other things down the road. When I heard 50 million, I thought, oh, they're giving them 50 million. That makes sense. But that's not what it is. So I don't know. I don't see it as the panacea for what we're talking about here. I know that's not what it was meant to be, but I didn't think it warranted as big a event as occurred yesterday.
Yeah, I mean, you could have had a small press conference.
Yeah.
For that, where you had like the mayor and the unions and Curtis Jones, since it's in his district, and maybe the council president, maybe like 3 or 4 people. I mean, because you already assume that the audience is going to be made up of most of the Parker administration, because for some reason they must come to every press conference.
Yeah.
But, this, when you put up something like this, there's got to be a bang for the buck. There's got to be a wow factor.
Yep.
And I'm not, when you're talking about a $50 million loan, you're basically saying, okay, we have put this Band-Aid on this gushing wound. And while that's important, all it does is get you to the hospital so that you can get some stitches.
Yeah.
You could have done this with less people, and it wouldn't have made people say, is that all there is?
Yeah. Well, we're going to have to leave it there, Denise. Before we go, though, I just want everybody to be careful this weekend. There is a prediction of a lot of snow coming in Sunday. Predictions can be wrong, but make sure if you're not prepared yet, try to get prepared the next day or two, because it could be a couple days before things clear up if we are supposed to get the amount of snow that people believe we're going to get. So be careful. Denise, I know you'll be careful.
Oh, yeah. And also, remember, if you have not registered yet to hang with the hall monitors on January 30th at City Hall, go to hallmonitor.org and register to come and join us.
Yep. All right. Well, we'll see everybody next week for more Hall Monitor.